a lot of our patients, right, come in and they're like, oh, my friend has it under the muscle. That's what I want. Or the opposite, or I saw online.
Hello, everybody, and welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. I am one of your hosts, Dr. Ashley Amalfi. I'm here with my good friend and another board-certified plastic surgeon, Dr. Smita Ramanathan. Hi, girl. How are you?
Hi, I'm great. How are you?
I'm so good. So I love that this topic that we're doing, we are just kind of hitting all these heavy hitter questions that you guys have about breast augmentation. And I would say this is like one of the most common ones I get every day in the office, right? Everyone wants to know.
Everybody wants to know. Yep.
What is what is it, girl? Tell us.
The question is above or below the muscle. Do we want that implant above the pectoralis muscle or below it? And, it's an important question to ask. It determines the look that you're going to get to some extent. So, we're happy to answer it. So what do you tell your patients? I think it's yes or no, right? You do both.
Yeah. I do both. Do you do both?
I do both.
I do both. And so just like everything else that we talk about on here, there is a right patient and a right surgery for you. And that's why you want that board certified plastic surgeon. You want to have that really personalized consult, because you're going to talk about the look you want and then also your lifestyle. And both of those things are going to play into our recommendation for which one is right for you, right?
Yeah, absolutely. I think, it's a lot of our patients, right, come in and they're like, oh, my friend has it under the muscle. That's what I want. Or the opposite, or I saw online. And at the end of the day, it's based on your anatomy, what your goals are, what you want the look to be afterwards. So it's very personalized to you, and you need to go to someone who can give you all of the options.
So to break it down quickly, an implant below the muscle is going to have more tissue on top of it. So it's going to have better coverage. It's going to squish the upper pole of the implant, give you a little more of that teardrop shape, but it is under your muscle. So if you're a big workout person, you have really big, thick muscles, you're flexing your pecs in your daily activities, then the movement of the muscle might bother you. We call that animation deformity. So that is kind of the pros and cons of being under the muscle. Do you want to talk about kind of the nitty gritty of over the muscle?
Right. So over the muscle is going to, and a lot of it sort of depends on how much breast tissue that you have. So, but it can give you more of that augmented appearance because you don't have that natural slope at the top. You'll see maybe more of the shape of the implant itself, right? So it's going to have that like rounder appearance. It's also great if you do have that wider cleavage and you don't want that, right? You want to position those implants a little bit closer. It gives us a little bit more flexibility since we're not limited by the position and the insertion of the muscle. So I would say those are sort of the biggest things,
Absolutely. So and when we talk about over the muscle, you'll see some people call it subglandular. Some people do something called subfascial, which is under that thin little layer on top of the muscle. Talk to your surgeon about what they do, and those are sort of the nitty gritties that we'll get into, and we'll kind of explain to you why we do it that way. But I wouldn't worry too much about that. I would just talk to your doctor as the patient about your goals, and we will help you pick the right plane for your implant for you, whether it's under or on top of that muscle.
Right. Perfect. Either way, you're going to love your results. So that's the important thing.
Don't stress. We'll help you.
Don't stress. Yeah. Just come and make sure that you can talk to us exactly about what your goals are. Sometimes those wish pictures, I know you have your patients bring in wish pictures too. It's helpful to sort of make sure we're on the same page so we can give you the results you want. But guys, this was a great one. I love these, Ash, like quick and simple.
Absolutely. I can't wait. We'll answer your next question next week, you guys. Take care, subscribe, and we'll see you soon.
Bye.